Namaste. Welcome you all for the yoga session. In this session, we are going to do some postures for balance and stability, along with some simple breathing techniques to relax both the body and the mind. To begin with, let us do some preliminary postures. Lie on your back, fold both legs, heel closer to the hips, stretch both arms up. Relax the complete back muscles, sensitize the back to the breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Watch the breathing. Press both the foot. Tighten the corners of both the knees. For that you have to press the calf muscle against the thigh muscle. Keep both arms straight. Watch your breathing. As you inhale, abdominal cavity should expand. As you exhale, it should contract. This breathing and some of the postures that you are going to do now helps the core muscles to prepare themselves for other movements. Rise your right leg up. Stretch the heel, toes towards the knee, pull the kneecap. Tighten the front of the thigh, the quadricep muscles. Feel the stretch in the muscles of the leg. Fold down. Left leg up. Stretch the heel. Pull the kneecap. Tighten the thigh muscles. Feel the stretch in the back of the thigh, the hamstring muscles and the calf muscles. You have to stretch the heel, that is toes towards the knee. Be aware of your breathing. Watch your hip and the lower back. Down. One more time. Right leg up. Pull the kneecap. Stretch the heel. That activate the Achilles tendon, which will further enhance the stretch in the calf muscle, which enhances the stretch in the hamstring muscle. So it is a kinetic chain. Watch. Down. Left leg. Pull the kneecap, stretch the heel. This is a good and simple preliminary stretch for the muscles of the legs, hips, and also the back. Do not hold the breath. Breathing should be calm and steady. Down. Right leg up. Fold. Hold from both the hands. Hold the knee and pull the knee towards the chest. Even here, stretch the heel, that is toes towards the knee. On both the legs, squeeze the hamstring and the calf. so that the inner corners of the knee get engaged. Breathe abdominally. Feel the muscles of the hips. Release right leg. Left leg up. Fold. Hold the knee. Pull the knee towards the chest. Do not move the knee away from the trunk. Pull it closer in the same plane. This is good for the gluteal medius and minimus muscles. A good breathing also helps in invigorating the abdominal organs. Release left leg. One more time, right leg up. Hold the knee, press the knee closer to the chest. Even the left leg should be active, in the sense you should activate the hamstring and the calf, tighten the inner corners of the knee, press the left foot. So this simple stretch helps the back also to relax. Release right leg, chain. Left leg up, fold, hold the knee, press the knee towards the chest. Watch your breathing. These stretches prepare the core muscles for further movements. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it across the left thigh. From right hand, push the knee. As we inhale, feel the base of the spine. Tighten the corners of both the knees. Ideally, the right heel should be pulled closer to the root of the left thigh. But if the knee is stiff, you can limit appropriately. Release right leg, chain. Left leg up, fold from right hand, hold the left ankle joint, pull it across the right thigh. From left hand, push the knee. Do not allow the pelvic rim to rotate. Feel the base of the spine, both as we inhale and exhale. So as we inhale, the bottom of the abdomen, the middle, then the top should expand, and as we exhale, it should contract. Release left leg. One more time, right leg up, fold, pull the heel across the left thigh, push the right knee. This is a simple movement to effectively mobilize the sacroiliac joint at the base of the spine. That is the meeting point of the hip bone and the spinal column. Release right leg, chain. left leg. Fold it across, push the left knee, breathe mindfully. Slow inhalation, slow exhalation. Release left leg. Stretch your left leg, slowly roll on to the right side. Sit upright. Stand up in Tadasana. Join the heel, join the big toe. Pull the kneecap, roll the thighs in, squeeze the buttocks. Navel and chest up. Stretch the arms down. Scapulae should move little down and closer to each other, so the chest is well elevated. Look forward. Watch the pressure distribution on the base of the foot. Pay attention. Pressure distribution on the heel, sole, inner arch, outer arch, that the medial and lateral arches of the foot. Just watch. Now close your eyes. When you close your eyes, you can see this pressure distribution or the variation of the pressure changes all the more. Feel the base of the foot. Develop a feel for the pressure at the base of the foot. Keep the kneecap pulled. The moment you close the eyes, the swing slightly increases. The movements at the ankle and the knee also increase. In the bargain, actually it helps the ankle and knee joints. Just be relaxed. Now with eyes open, just rise your right foot slightly up. You are doing single leg stand, balancing on the left foot only. Right leg slightly flexed. You are standing on one leg, and the moment you do that, the left ankle gets a lot of movements. You can see the left ankle, left knee. So these kind of postures are very good for improving the ankle stability as well as knee stability. It enhances one's ability to balance. Be aware of all the movements that happen in this posture. Especially you should watch the ankle, knee, and then the hip. Right foot down. Chain. Left foot slightly up. Keep the eyes open, look forward. Now watch your right foot, how the pressure varies. Watch your right ankle, right knee, right hip. Even the back does a lot of adjustments. We are trying to impart and improve the balance and stability in this session. So when you rise one foot up, only one leg has to balance and stabilize the complete loading. So this is the first level of challenge. Watch the ankle, watch the knee. These simple postures help even during the rehabilitation of ankle and knee joints. Keep the left foot down, stand upright. Now we are going to do with one more challenge, that is, rise your right foot up, then close your eyes. So now single leg stand with eyes closed. The moment you close the eyes, the swaying increases, the movements at the ankle and knee increases. So just watch that. This is because the balance has a lot to do with our visual input. The fact that we are able to balance or even stand depends upon the visual input, the vestibular or the inner ear mechanism, and the neuromuscular control. So here visual input is cut off and a lot of things should happen. The neuromuscular control gears up to maintain balance and stability. So you can see the enhanced movement at the ankle and the knee the moment you close your eyes. So this is a single leg stand with eyes closed. Learn to balance, learn to stabilize. Watch all the joints. Keep the eyes closed. The right foot should not touch the floor or the other foot. Now keep your right leg down. Stand upright. Chain. Left foot slightly up, just 1 inch up. You just have to flex the left knee, then close your eyes and watch the right ankle, right foot. Look at the variation of the pressure at the base of the right foot. The swaying increases. You can see how the ankle, knee, hip, in fact complete muscular system is involved in trying to give you the balance. These are very useful in enhancing the focus. The complete foot musculature gets activated, the ankle, knee gets greatly benefited. And it also helps one to have a good focus. Now keep the left foot down, open your eyes, sit down for a simple breathing exercise. Sit on a folded blanket, hips on the folded blanket, foot down, chest up, navel up. Wrist should rest on the knees, palm should face upwards, tip of the thumb and index finger in contact. Keep the eyes closed, relax your facial muscles and organs, relax your eyes, nose, throat and the jaws. Just watch your breathing. Pay attention, be a witness to the incoming air and the outgoing air. As you inhale, the abdominal cavity should expand, and as you exhale, it should contract. This is the simple breathing technique. Watch the movement of the diaphragm. Diaphragm is the major muscle of breathing that divides the chest and the abdominal cavity. As the diaphragm contracts, it flattens towards the abdominal cavity, pushing the abdominal viscera down. That's how abdominal cavity expands. Lungs expand and the air gets in. And as the diaphragm relaxes, it flexes into the chest, compressing the lungs, the air comes out, abdominal cavity contracts. Just watch that mechanism. Keep the chest as stable as possible. That is, as you inhale, the bottom of the abdomen, middle, then the top of the abdomen should expand slowly, gently, all around. And as you exhale, it should contract. Pay attention to this breathing. This is one of the simplest, most effective breathing. The diaphragm abdominal breathing. It relaxes both the body and the mind. This is the simple, natural breathing. Just pay attention. And try to exhale longer than you inhale. If possible, exhale twice as long as you inhale. That is, if you inhale for 3 to 4 seconds, try to exhale for 6 to 8 seconds. But do not force yourself. It has to be done in a very relaxed, comforting, soothing, effortless manner. Aware of your posture. Should be seated upright. Continuously, thoroughly, completely watch your breathing. Watch the air coming out, going in, which nostril is dominant. Just pay attention. Be relaxed. Stand up. Stand in Tadasana. Join the heel, join the big toe. Pull the kneecaps, squeeze the buttocks. Navel up, chest up. Stretch both arms down. Right leg up, folded in padmasana, taking the right heel up and close to the root of the left thigh. Hold the right foot from left hand. You are folding your right leg, balancing on only the left leg. There is another balancing posture. Do not allow the right knee to move forward. You should push it back to the same plane as that of the left knee. Watch your left ankle, left knee. Try to stabilize. See the pressure variations on the foot, on the ankle. Be focused All these balancing postures also enhances our ability to focus. So keep the eyes open. Release your right leg. Come to Tadasana. Then chain. Rise your left leg up. From right hand, hold the left foot. Take the heel to the root of the right thigh. Push the left knee towards the right knee. Balance on the right leg. One of the knee, that is the left knee, is in padmasana. So obviously very good for the knee. And different ways of standing involves different group of muscles. So these variations also help to trigger various muscles that provide balance and stability. And these postures also improves the neuromuscular control. It gives a good training. So initially do them with eyes open. Release left leg. Stand in Tadasana. Now we look at the next challenge. Fold right leg up in Padmasana, holding the foot from the left hand. Now close your eyes. So this is the next challenge. The moment you close the eyes, the balancing becomes more challenging, calls for better hold on your stability, triggers the muscles more intensely to maintain balance, thus improving the stability of the ankle, knee and the hip joints. For all these things, the frame of mind is also equally important. Right leg down, left leg up. Hold the foot from the right hand, pull it up in Padmasana. Take the left knee slightly back, balance on your right leg, close your eyes. So once the visual input is cut off, balancing becomes more challenging, more demanding on the neuromuscular system. So be watchful, be aware. See how the foot, ankle, knee, hip and the muscles connecting them behave. Now release left leg. Sit down on the blanket. Sit upright. Palm should face upwards. Tip of the thumb and index finger in contact. Have complete musculoskeletal awareness. Watch your breathing Keep the eyes closed. Watch both the nostrils, the right and the left. Watch the flow of the breath. As we inhale, abdominal cavity should expand. As we exhale, it should contract. This breathing greatly helps for the mind to relax. Keep the tongue relaxed. Now take your right hand, fold the index finger and middle finger inward, then bend the thumb and the ring finger like a calipers from the right thumb. Close the right nostril. From the ring finger, partially close the left nostril. Exhale through the left, inhale through the left. Keep the right nostril closed. This is Chandra, bedana, pranayama, uni-nostril breathing. From the thumb, you should close the right nostril. You should operate at the bridge of the nose, not at the tip of the nose. From the ring finger, partially close the left nostril. That is, it is not fully open nor fully closed, slightly open. And exhale through the left, inhale through the left. And as you inhale, the abdominal cavity should expand. As you exhale, it should contract. Try to exhale longer than you inhale, but only through the left nostril. And learn to keep the right hand properly so that the chest does not sink. You should be seated upright. Breathe slowly, steadily, calmly. Do not hold the breath. Watch your inhalation, watch your exhalation. Be relaxed internally and steadily watch the breath. You are doing left nostril breathing, Chandra, bedana, pranayama. This is also one of the very relaxing breathing technique. So we are combining breathing with some of the balancing postures because they go hand in hand in relaxing the complete neuromuscular system. Keep the tongue relaxed. As you inhale, abdominal cavity should expand. As you exhale, it should contract. And try to exhale longer than you inhale, typically 1:2. The flow of the breath through the nasal cavity helps to stimulate the brain. Now release your right hand, relax your breathing. So these breathing techniques helps to stimulate the brain cortex. Stand up in third asana. Join the heel, join the big toe. Pull the kneecap. Now right leg up, flex the knee, catch the right foot from both hands from behind, pull the heel closer to the hips, push the right knee slightly back to be in line with the left knee. This is also a single leg balance. Keep the eyes open. In this, the quadriceps gets a good stretch. So this different positioning of the legs also help in involving and invigorating all the muscles and ligaments that help balance and stability. Release right leg, then chain, left leg, fold, hold the foot from both hands, pull the heel closer to the hip and push the left knee to be in line with the right knee. You are balancing on right leg. Feel the pressure on the right foot. Watch the variation of the pressure. Watch your ankle, knee, hip. Look forward. All these balancing and stability movements are good for ankle, knee and hip. Release left leg, stand in Tadasana. Now we go to the next challenge. Raise your right leg up. Hold from both hands. Now close your eyes. The moment you close your eyes, you see that there is a sudden increase in the demand on the neuromuscular control. Just watch that. Stabilize. So this also calls for a greater degree of focus. Release your right leg, then chain. Left leg up, hold the foot, close your eyes. Feel the movements at the ankle, at the knee. Release left leg, then sit down for one more breathing exercise or pranayama. Sit upright, chest and navel up. We are going to do the Surya bedana pranayama. For this again, you have to use your right hand, or alternately one can use left hand. If you are using right hand, you have to fold the index finger and middle finger in. That is, first open the palms, then close the index and middle finger, bend the thumb and the ring finger to act like a calipers. You can stretch the little finger, then raise the right arm from the thumb, partially close the right nostril, from the ring finger completely close the left nostril. So the region of operation is slightly above the opening of the nostrils. So left nostril is completely closed from the ring finger. Right nostril is partially closed, that is slightly open from the thumb. So exhale through the right nostril, inhale also through the right nostril, and breathe diaphragmically, abdominally. That is, as you inhale, the abdominal cavity should expand, as you exhale it should contract. So you should inhale and exhale only through the right nostril. This is called Surya bedana pranayama. Chandra bedana and Surya bedana are supposed to help the right and left hemispheres of our brain respectively. Keep the tongue relaxed, be watchful, be aware of your breathing, have complete postural awareness. And you must keep the right hand in such a way that the shoulders remain even, the chest does not sink. Make the breathing slow and steady. So as the air flows through the nostrils, there are very fine receptors which get stimulated, and they are the ones which help even the brain to get a good stimulation. And these kind of Chandra bedana, Surya bedana, pranayama have a good impact on our nervous system too. So that is the reason why we are coupling the balance and stability postures with these breathing techniques. So both of these together help in rejuvenating and soothing our neuromuscular system. Relax your right hand, relax your breathing. Slowly stand up. Third asana. We are going to do one more balancing posture. Join the heel, join the big toe, pull the kneecap. Rise your right leg up. Take the right heel to the root of the left thigh. Press the right foot against the left medial thigh, that is the inner portion of the thigh. Right heel to the root of the left thigh. Both hands on the waistline, and ensure that the right leg is in the same plane as the trunk and the left leg. Keep the eyes open, chest and navel up, balance on one leg. This is the so-called Vrikshasana. Traditionally very well known posture. for balance and stability. Watch your knee, watch your ankle, watch the movements there. Complete foot, all the intricate joints in the foot, they are triggered. Foot is an amazing system, and all this balance and stability inaugurates all the intricate joints, muscles, ligaments in this complicated foot. Right leg down, chain, left leg up, left heel to the root of the right thigh. Press the left foot against the right thigh. Both hands on the waistline, chest and navel up, eyes open. Balance on your right foot. Be aware, be focused. So this balance and stability also demands a higher degree of focus. Be aware of the movements, especially at the base of the foot, how the pressure varies back and forth, sideways. Release your left leg, stand in Tadasana. Now we are going to take the next challenge. Right leg up, right heel to the root of the left thigh. Press the right foot against the left thigh. Keep the right knee in the same plane as the left knee. Both arms, both hands on the waistline. Close your eyes. The moment you close your eyes, the balancing becomes more challenging, demanding. Keep the eyes closed. This calls for a greater degree of focus, attention, and concentration. Be watchful. Keep on observing. Be involved. Release right leg, chain, left leg up, left heel to the root of the right thigh, both hands on the waistline. Close your eyes. The moment the visual input is cut off, you see the balancing becomes more involved. Single leg with eyes closed. This enhances our ability to balance and stabilize. It enhances our attention or focus, concentration. It rejuvenates the neuromuscular system. Release your left leg down. Sit down on the blanket. Hips on the blanket, legs on the floor. Sit upright. Chest and navel up. Be relaxed. Relax your tongue, nose, throat and the jaws. Now we are going to do as earlier the abdominal breathing. As we inhale, abdominal cavity should expand. As we exhale, it should contract, because this is the most relaxed form of breathing. Now we are going to do the Nadi shodana pranayama, or alternate nostril breathing. Take your right hand up, fold the ring and middle finger in, fold the thumb and ring finger to form a caliper, stretch your little finger, from right thumb close the right nostril, from the ring finger partially close the left nostril, exhale through the left nostril, then inhale through the left nostril, close the left nostril, partially open the right nostril, exhale through the right nostril. Then again inhale through the right, exhale through the left. Do this alternatively and ensure that you exhale longer than you inhale. Typically 1:2. So this Nadi shodana pranayama, or alternate nostril breathing, greatly helps the nervous system to completely relax. So use the thumb and the ring finger as a calipers. You have to go slightly above the openings of the nostrils, where you feel that hard bone, and just there you have to operate. You have to use the tip of the thumb and the ring finger intelligently to control the flow of the breath. It should be done alternatively. Exhale through the left, inhale through the left. Then exhale through the right, inhale through the right. And this pattern of breathing helps in imparting a great degree of relaxation, calmness. Keep the tongue relaxed. Be aware of every breath. Meditate on your breathing. You are doing Nadi shodana pranayama, alternate nostril breathing. So this balance and stability postures, along with the simple breathing techniques like Surya bedana, Chandra bedana, Nadi shodana pranayama, helps in rejuvenating the neuromuscular system. Be watchful. Be aware. Meditate on the breath. Get completely, totally involved. Do not compromise the posture. Must keep both the shoulders even, spinal column upright, and right hand should be steady. And control the flow of the breath properly. These type of breathing exercises, they have immediate effect. You feel the relaxation then and there itself. Just watch. Do not hold the breath. Make the breathing slow, steady, calm, and without jerks. Now relax your right hand. Relax your breathing. You are completely relaxed, both physically and psychologically. Feel that great sense of inner calmness and quietness. Namaste.